So good afternoon, everyone. Welcome to Member Cafe. We're going to wait just a few moments while everyone gets logged in before we get started. All right, so good afternoon. My name is Ann Gloff, and I'm part of the member engagement team here at Partners Health Management. So welcome to Member Cafe. I want to thank you for joining us today and spending some of your afternoon with us. So before I move forward, I want to share with you who's joined me on the screen from the Partners team. So we have Beth Brooks. She is our Zoom guru, and she is going to make sure everything is running nice and smooth behind the scenes. We have Stacy Lawrence. Stacy, you want to give a wave? Stacy is going to be dropping information into the chat for you while we go through our information. Also Cindy Trova, she is our member engagement manager and liaison to our CPAC, Consumer and Family Advisory Committee. And Allison Crotty, our senior director over member services. And Amber Matthews from the community engagement. She is our training manager. And I'll introduce our other guest speakers in just a moment. So just a little bit of housekeeping before we get started. I wanted to let you know that today's session is being offered in closed caption. If you really don't need that and it's a distraction to you, you simply just hover over that and you can click on this feature and turn it off. And so for those of you who are joining us today and you're not familiar with Partners Health Management, we are a managed care organization. We are contracted by the state of North Carolina to manage Medicaid and state funds to fund behavioral health services. So you may or may not be familiar with those words, behavioral health. So when you think of behavioral health, think of individuals who need support and treatment for mental health, substance use disorder, intellectual and developmental disabilities, and traumatic brain injury. So a few more things I just want to share with you, that our meeting is being recorded. So please be careful about sharing private information. If you raise your hand and choose to use the mic to comment or ask a question. If you want to talk with any of us here at Partners, our member engagement team, we can talk with you. We can set up a time to do a one-on-one to talk with you about a specific scenario, perhaps a member of your family that you need some help with. One question that always is asked is, are we going to get the slides? And so, yes, you are. We will share that with you by sending out a follow-up email after the session is over. And so during our session today, I want to invite you to enter any questions that you may have during the session into the Q&A. And you'll see that feature at the bottom of your screen. Looks like two little chat bubbles. If you click on the Q&A, you'll be able to enter those questions. And after our guest speakers have completed their session, we will moderate those questions and make sure those get answered for you. And at that time, you can also raise your hand if you would prefer to share your comment or question out loud. All right, so now let me introduce to you our guest speakers. So today with us to talk about mental health, self-care, and suicide awareness is Kevin Markle. Kevin is the Director of Education and Advocacy at Mental Health America of Central Carolinas. He holds degrees in psychology and child and adolescent psychology and is a consultant on crisis prevention, conflict management, and de-escalation for numerous organizations. He has dedicated 23 plus years of experience in supporting adults and youth in overcoming personal struggles with their mental health and champions efforts for access to resources for everyone. Currently, he works with community partners and individuals to provide educational opportunities through a group of instructors through Mental Health America of Central Carolinas. Kevin is a QPR Master Suicide Prevention Trainer, a lead instructor in mental health first aid curricula, and is a certified NCI trainer with the Crisis Prevention Institute. Also joining him today is Rebecca Bagley. So Rebecca is also with Mental Health America of the Central Carolinas, and she is the Youth Outreach and Education Specialist. So I am going to let Kevin and Rebecca take it away.
Great, and thank you, Ann and partners, for the invite today. Hearing my bio, that's a lot of stuff, but I'm very, very grateful to be a part of this conversation. I also want to just say Happy Suicide Prevention Month, if we weren't aware. We talk about a hard topic quite a bit at Mental Health America, but it's great that we have a month dedicated to bring awareness to an often hard to talk about topic. Becky, if you want to share our PowerPoint, and I'm just briefly want to share a little bit about some of the programs and the work we do at Mental Health America of Central Carolinas. We are a nonprofit primarily serving Mecklenburg and Cabarrus counties. Although during the last few years, a lot of things have been virtual and we have had access points and people from kind of all over the state and even out of state joining us for different educational opportunities. We have several programs, and I'll just briefly, we'll share this information, but want to highlight a couple cool things that we offer in Mental Health America. ComPeer, which is a volunteer program that matches adults with lived experience with a friend. It's a true friendship match. And what's really neat about that is we see people develop relationships, particularly those who are experiencing isolation due to mental health symptoms. So that program is something we have available. Again, everything we do is free or at no cost. And we do a lot of that through our partnerships with folks like partners, right? We're very happy to say that during COVID, we were able to secure funding and we opened up a counseling center located in Mecklenburg County where we are serving people who are uninsured or underinsured, particularly marginalized communities. As you all probably are very well aware, access to needed treatment is not an easy task. We could probably open 20 more if we could, but that's something we found that we needed a role in our community and we stepped into that space. The program that I oversee and what my team are actively doing is creating opportunities to educate the community with good mental health literacy. We really do believe as part of our mission that when we know better, we do better. I say that quite a bit. And through trainings like QPR, which is our suicide prevention training, mental health first aid, and some other tailored specific things that we've put together, workshops and presentations like today's, we again want to start the conversations with everybody to be able to talk about health as a whole perspective, right? And then lastly, as you see on the screen, our Parent Voice program, that is an opportunity. It's like a peer support run program where parents who've raised a son or daughter with some challenges, be it mental health, substance use, or intellectual developmental disabilities, kind of walk that journey with other parents. Again, as a parent myself, we often find ourselves in the routine of how we're raising our children, and Parent Voice can offer a support to that, right? To step in and maybe help with school-based meetings, getting access to mental health care, et cetera. Again, that's a program that I'm a big fan of. Definitely something that want to highlight. So if anybody's looking for some needs or just someone to talk to about raising their son or daughter, that's a great resource for our communities to have access to. So we wanted to kind of talk a little bit today about mental health, and I want to generalize this term for a very specific reason. When we hear the term mental health, our minds and our language often goes to deficit-based. We have a tendency to look at this from negative associations through illnesses, depression, feeling hopelessness, or just that overwhelming thing. And we like to say that health is health, right? Our brain and our physical body work in tandem. And we really want to start to, encourage everybody to really look at our whole health that way. When we exercise, maybe for our physical health, but we also know that there's benefits for our mental health as well. So as we kind of go through this presentation, think about health as a whole perspective. And when we have a need in one area, certainly when we support that, our whole body can heal from things that we might be struggling or dealing with. So a couple things, and again, I'll keep this very kind of direct and base level when we talk about mental illness, or particularly mental health diagnosed disorders, right? There are three main diagnoses that we typically see when we talk about mental health. NAMI says about 1 in 4, 1 in 5 adults in the United States will experience a diagnosable mental health disorder. The major ones are anxiety disorders, mood disorders, which would include bipolar, depression, probably the most common one, and then post-traumatic stress and trauma, PTSD. And again, that is something that I think we're doing better as a community of recognizing that trauma is a symptom of nearly all mental health diagnosis. Our experiences through life and how we heal or how we interact with others can really help or create more problems for our mental wellness, right? So understanding the effects of trauma is important. And it's something that we look at as a community, particularly in the clinical side of things, that people experiencing trauma are much more at risk for some severe mental health crisis without support. So know that, and again, we could go longer on that topic, but that is something that just for you to understand as we talk about some of these concepts, right? People are going to deal or manage their symptoms in different ways. And there's some things that we as supporters or family members and friends want to keep in mind if someone is struggling. And I always tell folks, when somebody is struggling, that it's okay to talk about it. And we want to understand that we may be seeing some things that are out of the ordinary, I'll use that term, for someone that we love and care about. And it is absolutely okay to confront them, and not in a negative way, but in a way that says, hey, I see that you're going through some things, and I want you to know that I'm here, you're not alone, and that there's resources that are available. Couple things I'll point out that you can see on your screen, particularly anger. We like to kind of relate that to, have you ever heard this expression that anger is sadness's bodyguard? Oftentimes when people are feeling low self-esteem, low self-worth, the outward expression could be to push people away, irritability and anger. They're actually, if you were to look at the diagnostic criteria for depression, anger is actually a symptom of that. So again, a little bit of knowledge here that if we see those types of behaviors and we're concerned that somebody might be dealing with a health-related issue, it's okay to step into that space and offer support. Again, feeling isolated, alone, we hear that a lot from people experiencing mental health challenges. So those might be some signs or indicators. If you know somebody experiencing that, how do we get them connected to help? And who are those folks that we can reach out to? Again, partners being a great example of someone you could lean on and offer to get that support for that person. There are things we can do without even, maybe having to have that conversation, right? Sometimes it's hard to talk about what we're observing in people that we care about. And what are some immediate resources that we as friends, family members, community members can do, right? You've all, I hopefully have by now heard that the National Suicide Prevention Hotline has changed to a 3-digit number. That is a huge win. The number is now 988, with the goal that all mental health or crisis response calls will go through that number. I will share that if you're not aware, a lot of us that use cell phones, 988 uses your area code to kind of expedite crisis response times and calls through their crisis center. Now, if you move to the Carolinas from California or Florida and you kept the same phone number, be aware if you do call that number, let them know where you're calling from, and that'll help at least get those crisis response if that's something you need available a little bit more quickly, okay? We know that there are a lot of local mobile crisis numbers in different areas. I know in Mecklenburg County, we have a great relationship with some of our local mobile crisis numbers. A warm line, and I'll just kind of differentiate between crisis and warm line, that's a number that you can call if you're just experiencing a rough time, if you need somebody to talk to. Certainly 211 is another great resource to talk to another live human being and just, again, talk through what you're observing or what you might be dealing with and get access to those resources. And then certainly in the workplace is something we're seeing a growing number of people reach out for their employees and their team members is workplace wellness, right? I think one thing we've learned over the last few years is that, how are we well in all areas of our life? And most employers have what's called an EAP. It stands for an Employee Assistance Program. Take advantage of that. We see the data that most employees don't utilize that. And that is really a shame. It's a huge benefit that all of us can lean on and use. And again, it could be for just maybe managing finances all the way to experiencing a mental health crisis. So that's a good reminder for anybody in the workplace to utilize those tools. And then certainly not a shameless plug, our website, since we've got a short period of time, is chock full of resources. It's mhaofcc.org. We encourage people to go utilize our website. We have various toolboxes and toolkits that are clustered with specific resources for youth. There's one for faith community, there's one for parents, etc. I'm happy to share those. And again, if there's something that, we don't have on there, we can certainly reach out to people like, again, partners to join forces and collaborate on what resources you as a community member may need. Okay. And then before we kind of talk, Rebecca's going to talk a little bit about self-care, but I want to highlight a few things that we all are subject to experiencing some challenges, right? Working in this kind of hybrid world, oftentimes are we taking time out of our day for ourselves, right? And when we're struggling maybe with our mental health, what are those basic fundamental things that we should be or could be reminded to be doing, right? Am I getting adequate sleep? I know that's something that I know our team, we talk about pretty regularly, working long hours. Are we taking time to take a break during the day? Hydration, and people that know me and particularly my team members hear me all the time, carry a water bottle, make sure that you're staying hydrating and nourishing your body. Are you eating? Those types of things, although it seems very simple, when we're not focused on our health, oftentimes those are the first things to go into decline or we start to forget to do. So if that's a friendly reminder for anybody on this call today, take some time for you, right? Just on those basic fundamentals. And then again, looking at it from a supporting standpoint, you can go to the next slide, Becky. What can I do, right? As a family member, and I tell people all the time, you do not have to have a degree in mental health to support somebody who might be struggling. I think a lot of us know if somebody is dealing with a physical issue, say they cut themselves, right? That basic first aid. The same thing should be applied to emotional wellness. And we're talking about mental health. Again, if I observe somebody close to me who may be having a rough time, or I know that they're going through something, on the preventative side, just letting them know that no matter what, I'm here to help you, that I will make myself available if you ever need to talk, asking people how they're doing and meaning it, not just those pleasantry on fines, really can go a long way. When we talk about supporting somebody, once we open up that dialogue or that conversation, that a lot of times we're going to be doing more listening and less talking, right? So empathizing with another human and allowing them to kind of get it out and express themselves goes a long way with helping that person in their journey to recovery from whatever that is that they're dealing with. Some things to keep in mind, and again, I know we could probably talk a lot about this as well, but our language and how we talk about mental health is really important, particularly for people who are newly diagnosed or experiencing, some form of diagnosis, they're aware of that, right? And how we talk about it is really important. I often tell people, if we're seeing something, don't beat around the bush, to use that expression, but be direct and use inclusive language, right? I know Amber is going to talk a little bit about suicide with you all, but call it for what it is. There's no such thing as a failed attempt, or the term committed oftentimes holds a lot of negative weight when we say that person committed suicide, right? That someone died by suicide, that someone's experiencing these types of things. The same thing holds true for just terms that we kind of throw around, like, oh, it's my OCD is acting up, or, the weather's being bipolar. I've heard that quite a few times. And again, I know there's no harm or ill intentions behind that, but someone with that diagnosis, it could push them further away from reaching out if they need help, if that's what they are hearing. I hope that makes sense. But so it's important to use good, direct and first person language when we talk about our health as a whole, particularly mental health. And then again, I cannot force anybody into getting help, right? So showing up is a big part of that. And asking questions, right? Who would you like to talk to? Is there somebody that could support you? I think that's a really important thing for all of us to understand, that I may have good ideas to help a friend or a family member, but really letting and allowing and supporting them to kind of drive their recovery is really where good things happen, right? And sometimes when we're supporting people, it may not be enough, right? We may have to make some calls. And I will encourage anybody that if you're worried that someone's dealing with a mental health crisis, sometimes we may have to call resources and get help for ourselves. Maybe reaching out to 988, the prevention hotline number, maybe calling mobile crisis. Certainly, if I'm fearful that someone might be actively engaged in some self-harm or thinking of suicide, I may have to call 911. And that's a hard thing to do. But again, we want to honor that people need help. And sometimes if we have to get professionals there, let's do that so we can connect people, because there's a lot of resources out there, but we want to make sure we're well-versed and we're also helping support people to get the help that they need. Okay. So with that being said, and I know, again, we'll stick around. I could talk all day. I'm going to hand it over to my co-trainer and co-friend, Rebecca, to talk a little bit about self-care.
Thank you so much, Kevin. So we're just going to spend a couple minutes talking on self-care, what it is, and some ways that we can practice self-care. So I have on this slide here that self-care is preventative work and self-care is suicide prevention. One of the sayings that we at MHA have is before stage 4, to seek mental health support before getting to that crisis point. And you don't have to live with a mental health condition to experience burnout and to experience reaching that crisis point. So this is just a reminder to do some of that preventative work. And I love this graphic here, which says you wouldn't let this happen to your phone. So why do you let this happen to your mind? Again, waiting till it gets to that point of burnout, points of crisis before reaching out for support, before letting your mind recharge and giving yourself rest. So what exactly is self-care? I feel like self-care is a definition that is thrown around so much these days. So we just want to first define it. And there's many different definitions, but the definition that we at MHA use is that self-care is an act done thoughtfully with the intention of caring for yourself in a way to increase happiness, focus, stability, joy, feelings of gratitude, and feelings of self-love. There are 5 different aspects to self-care, which include physical, intellectual, emotional, spiritual, and social. Self-care is a tool that can be used to reclaim your power, recalibrate your mind, and establish your own natural pace. So we have several different ways listed that we can self-care. Here at MHA, we have a 90-minute in-depth self-care training. So we're just going to give a few different examples of which we can self-care. And then in the next few slides, I'm going to go a little bit more in depth on just a few. So some of these ways that we can self-care are getting sufficient sleep, nourishing your body, again, going back to those basic things that we can do to care for ourselves. Time spent in nature. There's been a lot of research done on, grounding barefoot in the grass outside, being around, getting direct sunlight. There's research to show that just 10 minutes of direct sunlight a day can have such a great impact on our mental health. Limiting our time on social media, taking time to rest, engaging in a hobby that you enjoy, no matter what this hobby is, just something that makes you happy, and checking in with yourself, bringing awareness to and acknowledging your feelings. There is a feelings wheel that we use often, and I don't have it in this training, but I encourage you all to look it up. That's a feelings and sensations wheel, really working to name your feelings and acknowledge them and making space for all feelings. Then setting boundaries. And I have this graphic over here that says when we should take a break versus when we do. Again, we shouldn't have to wait to that point where we're mentally on E before giving ourselves permission to rest. So again, as I mentioned, I'm just going to go a little bit more in detail on some of those examples. So one is prioritizing in decision making. I'm not sure if you all are familiar with the term decision fatigue, but it is a very real thing that happens. And that is because we all make an estimated 35,000 decisions every single day. And making all these decisions can cause people to feel burnt out. I don't know if you've ever reached a point during the day where you're like, I don't want to have to decide what's for dinner. I don't want to have to decide what to wear. I'm just exhausted with having to make decisions. And you are not alone in that. That is a very real thing that we experience. And this can not only cause exhaustion, but it can also cause us to make decisions that are impulsive and irrational. So what can we do? There's a few things we can do to help mitigate this feeling of decision fatigue. We can use time management skills such as scheduling and making lists. We can use a timer cube, which is something one of our colleagues utilizes, which has a little timer on it for 5 minutes, 10 minutes, 15, 20, an hour to really keep us on track with how much time we're allocating to a certain task throughout the day. And then meal prepping, picking out clothes ahead of time, creating a shopping list, just some of those scheduling things that can help take the pressure off us for the next day. And then I'm not going to get too in detail with it, but to the right, there is a 4-cube graphic there, which is just a way to prioritize some of our decision making. And again, we will share the slides so you can look at this later, but just seeing what you can delegate off your to-do list, what are some tasks maybe you can delete, and really focusing first on what's most important. Boundary setting. So this is the second self-care example we're going to touch a little bit more deeply on. And first and foremost, I would like to just say that no one is entitled to your explanation of a boundary. You do not have to prove your worthiness of having a boundary to anyone else, and no is a full sentence. So what are some examples of setting boundaries? So this can look like saying no to taking on an extra obligation, whether that's at work or whether that's in your personal life. And I also will encourage you all, if you get a request from someone to take on an extra obligation, don't just think from the lens of, am I physically able to be there? But think from the lens of, what are the benefits if I do show up, and what are the benefits if I say no? And really honor your emotional bandwidth as well. Boundaries can also look like having difficult conversations, speaking up when someone says something harmful. So this can look like if someone in your personal life said something that was hurtful, but it can also look like if a colleague said something that was hurtful to you, having those conversations, letting them know how it felt, and really working to repair that relationship. And cutting off people from your support system. So if you have tried to set a boundary with someone in the past and they are just not listening, and not helpful, giving yourself permission to cut that person off from your life, really preserving your own energy by allowing the people in your social circle that are healthy for you, that lift you up, that make you feel good. And although I mentioned cutting someone off from your support system, the truth is that the majority of the time when we set a boundary with someone, it is to continue that relationship with them. And it's not an attempt to hurt them. And I have this graphic on the right because I think so often, especially as we're setting boundaries with people that have known us for a long time, whether that's partners or whether that's family members, a lot of time it, may bring about some discomfort. They may feel like it's an attempt or a punishment to hurt them or something like that. So we just have this reminder that boundaries are mutually beneficial. It's helping keep that relationship healthy so we can both show up as our best selves for each other. And so for a third self-care item, just to go a little bit more in depth on, we have a self check-in, just asking yourself some of these questions, such as, what do I love about myself? When is the last time we had some self-gratitude, feeling grateful and positive feelings towards ourselves? What do I need to heal? What is making me feel down right now? Just taking a moment to ask yourself, what do I need right now to get through the day, to feel good? What am I thankful for? When is a time recently that something didn't go my way, and what did I learn from this experience? And again, do the people around me make me feel energized? And these can be just questions that you take some time to ask yourself and reflect on, but they can also be journaling prompts if you want to take some time to do some gratitude journaling or to just check in with yourself with a tangible pen and paper. And those are just a few different ways that we can practice self-care. Again, we have many more in-depth trainings on mental health, such as mental health first aid, which is an 8-hour training. And we have other trainings like we offer QPR, which is a 90-minute suicide prevention training. And we have our self-care workshop, which is a 90-minute self-care workshop, which goes much more in depth on some of the things I listed, and also has many other topics included as well. I also have listed both of our phone numbers and email contacts for myself and Kevin. And so I'll turn it back over to Kevin.
Thank you very much. And just to, again, to kind of say something that self-care is not selfish, right? Oftentimes, maybe we don't put intentionality behind our mental health. And it's important. Just like exercising, are we taking care of our emotions and our mental health? So again, thank you. I'll hand it back to Anne. I believe Amber's going to talk a little bit about suicide prevention, but again, I just want to say thank you for the invite today. And anybody has any questions too, we'll be here. So thank you.
All right. Well, great. Thank you to both Kevin and Rebecca. She also goes by Becky. Great information. That self-check-in slide really resonated with me, and I am sure other things may have resonated with you as the listener. So right now, I would like to introduce Amber Matthews. She is part of our community engagement team and system of care trainer. She's our training manager, and she's going to share a little bit with you about QPR. And after Amber does that, we'll have a Q&A time. So I really encourage you to, think, do you have any questions about the information that Kevin and Rebecca shared with you? Or maybe you'll have questions about QPR. So as soon as you think of them, just pop them right into the Q&A and we'll go from there. So Amber, I'm going to let you take it.
Thanks, Anne, and thank you to Kevin and Rebecca as well for sharing all that insightful information. I love that self-care are things that we can build into our everyday routine as opposed to really setting aside, time aside to do that. So thank you both. So I wanted to talk a little bit about QPR. As it was mentioned before, QPR stands for Question, Persuade, Refer. It is 3 easy steps that literally almost anyone can do when it comes to talking to someone about suicide. if you're picking up on some of the warning signs or clues that maybe they're thinking about killing themselves or harming themselves in some way. And saying that, we do offer this training virtually every month. We also are able to go into agencies or communities or churches, and we've been in school systems before to talk about suicide prevention. One of the things that is the biggest component of suicide prevention is talking about it, right? A lot of times the people that don't talk about suicide very often, or, you know, are really stuck in that stigmatizing world of what suicide is and how it doesn't affect me. Education is key, and then talking about it is key. And both of those things are what we spend time during that hour-and-a-half session talking about. When we're not talking about it very often, we get uncomfortable around it. And so we really want to familiarize ourselves and the people that are around us, right, with the language that we need to use and the clues that we need to be picking up on. And saying that, though, why do we talk about suicide prevention? In 2021, over 48,183 people died by suicide in the US alone. I'm very bad at math. That's why I went into social work. But during the first part of QPR, we talked specifically about some of the statistics surrounding suicide. I would probably venture to say that all of us are affected by suicide in some way, whether it's we know someone who's died by suicide, or we know someone who knows someone who's died by suicide. It's right around in our communities, in our neighborhoods, in our workplaces, and in our families. So again, we talk about statistics, we talk about there's a state breakdown of the US of who has the highest rates of death by suicide and who has the lowest. And we talk a little bit about why that is, and access to resources. It's also broken down by age group and ethnic group as well. And those statistics really put a different perspective on suicide, the risk of suicide, and who all it's affecting. Right now, suicide is the third leading cause of death of young people aged 15 to 24. Up until recently, it was the second leading cause of death. So just know that it is very real and it's very prominent in our societies. Suicide's also an equal opportunity death. It does not matter who you are, where you are, how much money you have. It affects us all and can affect us all. That number too that I mentioned before in 2021, over 48,000, that's realistically, I'm a logical person. I need a visual. That's a commercial jet of people every other day dying by suicide. So just know that it is real and it is there. During QPR, we spend some time talking about warning signs, things to look for. What are people saying that are very direct, that are very black and white of, yes, I'm trying to tell you that I'm thinking about killing myself. What are some things that are a little bit more indirect and what we might have to look a little further into and ask a little bit more questions about? If we don't know someone well enough, what are their behaviors that I can look for? What are situations that I can be aware of that people may be in that could trigger some of those suicidal thoughts? And then we go through and talk about the actual 3 steps, right? How to ask the question, familiarizing ourselves with asking the question, verbiage that we need to use, why it's more important to say, are you thinking about killing yourself as opposed to, are you thinking about hurting yourself, and what the difference is and why that's so crucial for that person who might be thinking about suicide. And then we talk a little bit about how to persuade them to get some help and to stay alive, right? And then what are some resources that I can have on me at all times? Who can I call when I have this conversation with someone? We always say that it's a matter of when we have the conversation, not really a matter of if we ever have to have the conversation. So in saying that, just know that we offer QPR virtually. We can do it in person. If you see anything that you're like, have questions about, please let me know. Because we love talking about suicide prevention. The more education, the more people that are trained in QPR and suicide prevention, the more we can save people's lives. And that's what we really want to do when it comes to suicide prevention. So I want to thank you guys. If anybody has any questions, please put them in the Q&A. I'd be happy to answer them. And I guess I'll pass it back to you.
All right, thank you, Amber, for that great information. QPR, I'll just share that I have taken QPR. It's been a while. It's time for me to get a re-up and a reminder. But I have experienced having a conversation with someone who is very close to me. And I was very thankful that I had taken that course because it enabled me to ask the questions I needed to ask and to have the conversation I needed to have. And thankfully, that person is still alive and well and with me today. But again, just very thankful for QPR. All right. So our audience is very quiet today. I don't see any questions in the Q&A. So what I'm going to do now is share just a little bit more information about Partners Health Management. And please know that if you do come up with some questions while I'm talking, either about Partners, what I'm sharing, or about what Kevin and Rebecca shared with you, what Amber shared with you, please feel free to put them in the chat. Excuse me, the Q&A, not the chat. And then we'll touch on that before we close out for today. All right, so Beth, you want to pull that slide deck up for me? All right, so Partners Health Management. Who is Partners? So our goal here at Partners is to improve lives and strengthen communities by focusing on positive outcomes for our members. So Partners Health Management, we are an insurance plan for Medicaid and state-funded dollars. We're contracted with the state, and we manage a network of providers that ensure access to care for people who need support and treatment, as we've been talking about with mental health, substance use disorder, intellectual or developmental disabilities, and traumatic brain injury. So in receiving treatment, you wouldn't come into a Partners location or see Partners staff. You would access one of our providers. And our providers are specialized in all of those treatment areas. So we do contract with a large network of providers. I mentioned we're contracted with the state. So we do manage what's called North Carolina Medicaid Direct, just for behavioral health. And when you think about those words, behavioral health, just think about, again, mental health, substance use disorder, IDD, TBI. We also manage what's called the 1915I option. That's a set of services that is a fairly new option. We have a crisis call line, which operates 24 hours a day, 7 days a week, for those who have concerns about being in a mental health crisis or in need of mobile crisis. And then later on, we will begin managing one of North Carolina Medicaid's behavioral health IDD tailored plans. And it's anticipated that a start date will be in the first half of 2024. So currently, we serve 14 counties from Partners. There is a managed care organization. We're often called an LME MCO. There is one that covers every county in North Carolina. So we are one of them, and we serve Burke, Cabarrus, Catawba, Cleveland, Davie, Forsyth, Gaston, Iredell, Lincoln, Rutherford, Stanley, Surrey, Union, and Yadkin counties. So another thing I want to share with you, on the Partners website, we now have a member portal. It is named Member Connect. And when you go to our website, if you go to the upper right-hand corner, you can see we have it circled on the slide. You're gonna select Member Connect right there. And from there, you can create a login if you don't have one. And so anyone who is a member can create a login, or meaning that they're part of the health plan with Partners, or if you are a parent or a legal guardian, you'll be able to access that individual's information through Member Connect. So when Beth flips to the next slide here, I'm going to show you a little bit about what it looks like. So this is the portal. And when you sign in, it is personalized in that it's going to welcome you as to yourself or the member that you were connecting into Member Connect for. And here you can do a lot of different things. You can access some health screenings. There are self-health screenings that are connected to both physical health and mental health, behavioral health. You can also find resources. You can look at member handbooks. You can locate information about how to file a grievance or file an appeal. You can also look at some personal information about your eligibility, your current insurance status, different things like that. So, and this Member Connect portal continues to improve and be updated on it really on a daily basis. We are working on it to better it for you, the members of Partners Health Management. So next, I want to share with you about transitions of care. So with North Carolina managed care, individuals can move between health plans for different reasons. So the following are the primary reasons. You can see them right there on the screen there. So perhaps the member's service needs or benefit plan needs changed. So perhaps someone needs a more enhanced service because something has changed in their life. Their needs have become a little bit more complex. They can transition between health plans from a Medicaid standard plan to the managed care organization, the Partners Health Management or other MCO that has more enhanced services. It also could be that maybe you moved from one county to another and you need to transition care between the managed care organizations that cover your county. There's only one MCO for each of the counties. Or maybe your Medicaid status has changed. That would be another reason. So what I want to tell you is the quickest way to access transition of care is to go ahead and ask your healthcare provider to help you with completing a request to move process. You can also reach out to the Medicaid enrollment broker, and there's a website there on the screen that I know Stacy is dropping into the chat for you. And you can also call the enrollment broker at 833-870-5500, or if you need the TTY access, 833-870-5588. Regardless, there is a team here at Partners that is going to help you transition between the health plans and make sure that each agency, each organization has the right information and that you have a nice, smooth transition. So now let me share with you a little bit of information about member engagement. I mentioned earlier that I'm part of the member engagement team, and several of us other on the screen here are as well. So what do we do in member engagement? We're here for you. So we are kind of an extension of our call center. We advocate, we help you navigate our system. It can be a little bit complex, and maybe you just don't know which way to go, who to talk to. You can call our member engagement team and talk with us. We're going to help you get to where you need to be. We also provide education in the community, like we're doing right now with a member cafe. You'll also find us out in the community at health fairs with an information table. So if you want to connect with us, you're going to call 704-884-2729. And there you're going to be able to talk to any of one of the members of our member engagement team, our specialists that are there to help you navigate. You can also send us an email if you prefer, and you send an email to memberquestions@partnersvhm.org. With either method, you should hear from us within 24 hours. You'll also find us on social media. So look for Partners Health Management, follow us. All right, now I want to ask you, have you heard about the Pix Health mobile app? What a great tool to have in your toolbox. So the Pix Health mobile app can help you, or maybe someone in your family who's a member, can help you monitor both physical and mental health. So we encourage our members to to register for the Pix Health phone app. When you register as a member, you have an opportunity to earn a Visa gift card, and you'll see that information on our website. But to download this app, it's super simple. You're going to go to highpix.com, or you can call the phone number on the screen, 855-499-4777. And so within this app, it focuses on daily mood and wellness check-ins. It provides screenings for depression. There are screenings that you can do yourself in there about depression, anxiety, or loneliness. We offer messages and assistance through the app or by talking with the compassionate call center that's part of Pix Health. So the call center staff or peers They call them Andes. So Andes stands for authentic, nurturing, dependable, your friend. And so as you interact with this app, the Compassionate Call Center also interacts with you, and Pix Help will send referrals back to partners for individuals who may need more help or who we think may need more help. We're going to reach out to you as well and share that information with your care manager. And for fun, there are some research-based games and activities on the Pix Health app as well that really promote good mental health. So who do you call if you need assistance, or maybe you're in crisis and you really need some help? So if you're currently receiving service, the first call for you would be your provider agency that's providing your treatment or services. They're your first responder in crisis. You can also call your partner's care manager if one is assigned to you. And if you're not assigned in services or have general questions, you can call member engagement. I mentioned that just on the other slide. There's the phone number and email again there. And you can also call our call center at 888-235-HOPE-4673. So now let me share with you a little bit about our CFAC, our Consumer, Family, and Advisory Committee. So if you want to get involved with partners and really learn more and know more what's going on in this arena, this is a great way to get involved. CFAC is a volunteer group made up of members. They're members, family members, representing those who receive services in all the different areas: mental health, intellectual disabilities, traumatic brain injury, and substance use disorder. Representation in all those areas. And those individuals on the CFAC advocate on behalf of all individuals in the system and to improve the public and behavioral health system. So Partners CFAC is looking for more members. So if you're interested and you need more information, you can send an email to CFAC, CFAC@partnersbhm.org. You can also call our member engagement line and ask questions. They can help you. You can also reach out to Cindy Trova, our member engagement manager. You saw her on the screen earlier, and she is also the liaison to this committee. You can reach out to her directly at 828-323-8090. And there's also a link at the bottom of the screen for our website where you can find more information about CFAC. And now I'm going to tell you about another committee that you may want to be involved in. We have a few others as well, but this one in particular is named the Long-Term Services and Support Stakeholder Advisory Committee. That is a long group of words there. So we refer to it as LTSS, Long-Term Services and Supports. So examples of long-term services and supports are personal care services, home health services, hospice, private duty nursing, and home and community-based services for the North Carolina Innovations Waiver. So this is a fairly new stakeholder advisory committee. If you're interested in learning more and becoming part of it, your contact is Angela Griffin. Angela is a registered nurse, and she is also the member engagement operations manager here at Partners. So her phone number is there on the screen, and Stacy has popped it into the chat for you as well. And there's her email, agriffin@partnersbhm.org. And emails can also be sent to LTSS stakeholder applications at partnersbhm.org if you're interested in being involved. So I want to share just again some more information about our call lines. So the first block that you see, the call line, is the member and recipient services line. That's the number you hear us most often talk about, 888-235-4673. Its current hours are Monday through Saturday, 7 a.m. to 6 p.m. It's for callers who are Medicaid members, state-funded recipients, stakeholders. Really, anyone can call the line. It's focused on our members and stakeholders. We also have a new behavioral health crisis line. 833-353-2093. That number is available 24 hours a day, 7 days a week. It's open to anyone. I also want to let you know, if you know our other number that I mentioned previously, you can access the crisis line pretty quickly when you call that number. But the direct number is 833-353-2093 for behavioral health crisis. And the last one there is for our provider agencies. And that number is available Monday through Saturday, 7 a.m. to 6 p.m. for providers to support them in getting information about members or to get questions answered. So another thing that I really want to make sure is at the top of your mind is how important it is to stay in touch with us. You want to keep your contact information updated, especially in the world that we're in now with all of the changes going on with Medicaid across North Carolina, with Medicaid transformation. Partners may need to contact you about your health plan. And also incredibly important is if you receive Medicaid and something changes in your contact information, perhaps you move, you have a different address, you change your phone number or your email, you want to reach out to your local Department of Social Services to update your information. They are the keepers of your information. They share that information with us all the time. So when it's updated, your new information comes to us. So I want to make sure that you are aware that you really need to contact your local Department of Social Services. If you're a state funded recipient, you want to contact Partners Access at that 888-235-4673 to update your information. So again, staying in touch is really important. Another thing I wanted to share just before we close today is if you want to be in the know and stay connected, receive email information from us here at Partners, you can choose to subscribe. You can grab that QR code with your phone, or you can go to the link on the screen, which I know Stacy's putting in the chat for you. This is going to give you the ability to subscribe to different distribution lists that we send out information to. And last but not least, I really want to ask for your help. Your feedback is so important to us. So if you would please take a moment, grab that QR code. You can grab your phone right now and grab that code. It's going to take you right to the survey link for the survey, or you can use the survey link on the screen, which I'm sure is also in the chat. It's going to take you just a few minutes. Going to give you the opportunity to share if this information was helpful to you today, and also to share additional topics that we can share information with you or have other sessions in the future. All right, so that is the end of our presentation for today. And again, I just want to thank you for joining us. And again, thank our guest speakers for joining us today. So you all have a wonderful afternoon. One more thing, Member Café next month is going to focus on how you can get involved with those advisory committees. I mentioned 2 of them today to you. There are a few more, so you'll hear more about that in October. But again, thanks for joining us. Y'all have a great afternoon. Bye-bye.